Thank you, Mike, and thank you to SAMHSA and the Academy for the opportunity. We have Keith and Nadine here from Atlanta, and the Civil Rights Museum, which is in downtown Atlanta, has a water feature right behind it. On that water feature is a quote: "Never doubt that a small group of thoughtful, committed citizens can change the world." In fact, that's the only thing that ever has. Now, but how does a small group do that? Is it because of their valiant efforts? The famous story is of King Leonidas and his 300 Spartans who mythically fought valiantly and failed. So it wasn't their effort that actually made the difference. It was catalyzing, activating, inspiring many, many others in the Greek states to come and fight that battle alongside. So how does a movement spread? How does it activate? How does it inspire? Well, the International Declaration is one way that happens. And in 1989, a small group, people with diabetes, policymakers, some physicians gathered in a rural Italian village, and they looked at the science of the innovations that were out there, and they did a blue sky. They looked for what could be, and they declared that at a time when there was no basis for believing this, that diabetes would be a relationship in co-management between the individual and their physician. Many of us don't remember when you had to go to a physician to get a blood level, a sugar blood level. This has largely been accomplished now as a result of a vision that was put forward and that efforts that followed. Now, a little more, not quite 15 years later, a group in the United Kingdom, a similar small group, 40 gathered in Newcastle, and they studied what the diabetes pioneers had done, and they followed the same model. And at the time, the vision was outrageous. And that was that an individual who's having a first episode of psychosis would quickly move from diagnosis to treatment to recovery, and that they and their family could live an ordinary life. We're still in the U.S. making progress on having early intervention programs, but in the United Kingdom, where this occurred, instead of it being 70 some odd weeks for that treatment to really begin after that frightening first episode, it's as short as 22 days, sparked in large part because of an audacious vision and a pathway for beginning to make that happen. Now, Mike referenced the Suicide Care and Systems Framework document. We were motivated, inspired by the work at the Henry Ford Health System and also at the U.S. Air Force and others. We created a document. And again, that document could gather dust on a shelf, but we were inspired by Professor Joe Smith, one of the innovators in early intervention programs, who we met through one of these international summits. And she told us about these international declarations. So we started down a pathway together. And in 2015, we created the International Declaration for Better Healthcare of Zero Suicide. That document's been viewed nearly 20,000 times in countries all over the world. And we have a movement going forward. And we're very mindful of how do we create not only inspiring and activating, as we were, as Ed and Justin and leaders at Henry Ford were inspired by work of the Institute for Healthcare Improvement and Don Berwick. We were in turn inspired by them. Yes, we want that flame to pass forward. We also want those who are pioneering in this work to have a place where they can network and share and learn, and it becomes a true learning community, a global community. So, in 2014, Dr. Jerry Reed from the Suicide Prevention Resource Center and myself, we began to contemplate a global summit. And we thought if we could we did say to ourselves, if we got 2 nations together, not sure with a straight face we could call that a global summit, but 3 was our litmus test. I think we had 5. We had about 15 people come together. We leveraged an international initiative for mental health leadership meeting that was occurring in Manchester. and we all got together in Oxford in 2014. And the declaration that came out of that was actually a phrase that within a couple of weeks was used independently by Dr. Jan Makkenstorm, a psychiatrist with a large mental health provider in the Netherlands, and also the founder of a online service called 113 Suicide Prevention, and separately by Eduardo Vega. I heard it first from Eduardo. He stood up in a room like this, and he said, you know, I don't know that I'm so much against suicide. And of course, my ears perked up for what is he going to say next, as yours might have been as well. And he said, but here's what I'm definitely against, and that is people dying alone and in despair. And then Jan Makkenstorm, a few weeks later, it might have even been within 2 weeks, in Oxford said exactly the same thing from a continent away. And it became an initial platform for a lot of the global work of trying to take the Henry Ford experience and move it forward. In 2015, 50 of us met in Atlanta from 13 different nations. And Jo Smith facilitated that meeting, and she took us through that same process of an international declaration, and we created the document that I shared. And then in 2017, Sue Murray with Suicide Prevention Australia, we had 70 leaders from 15 nations, and we partnered with AMP, one of the largest corporations in Australia, and began to really see a ball rolling. We created a document at that meeting, from international declaration to local action. And then we the three of us and Richard McKeon here are just coming from the 4th International Summit in the Netherlands. We had 110 leaders from right at 20 countries. And we viewed actually Dr. Makkenstorm and myself went and through facilitation from Justin interviewed Dr. Don Berwick, who is really the grandfather of all this when you think about it. And we've just announced Joe Rafferty will host with us in the United Kingdom, back in the United Kingdom in 2020, the fifth summit of this. We talked a little bit about the zerosuicide.com website, which has a fidelity toolkit and information about resources and supports, as well as the implementation academies. That's the .com site. Separately, at zerosuicide.org, we are tracking the story and creating a social proof, if you will, as well as a hub for the innovation. And one of the tools that I utilize from the Institute for Healthcare Improvement is the process of change, from educators who till the ground, remove the rocks, get it ready, the redesigners, the innovators like Justin and Ed and Mike and Julie who help frame out the fidelity, the movers, people like Norman Lamb in the United Kingdom who created an entire national dialogue, and then those who implement, those who deploy it. People like Brian Amadani now at Henry Ford and Becky Stoll in the U.S., where we saw this implementation start. Numbers of implementations in the U.K., now 90 organizations as a part of the Zero Suicide Alliance. The Netherlands I've already referenced, Dr. Makkenstorm. This is a confederation of multiple providers who are now coming together. In Australia, we see one of the most robust implementations yet in a large healthcare system in the Gold Coast that includes specialty behavioral health, but is a large hospital system. Ian Daw in Ontario, Canada, is leading an effort that includes not only the hospitals and behavioral health, but schools. And we're seeing Steve Duffy in New Zealand, in Christchurch, also implementing. So we now have implementations in a number of countries. And at our recent event, actually, Yasu Shimizu, who led the law around the National Suicide Prevention Act in Japan, be very similar to our national strategy, laid down an ambition to move that forward. And then finally, this is the group, the 110 individuals from around the world who gathered in Rotterdam. You'll see that we have a number from Asia, Australia, Europe, and the United States that are still looking to have that cascading effect take us into low and middle income countries, and especially into Africa and South America.